And I think a lot of people experience feeling like they don't have choice in life. And psychedelics really, really unlock people's ability to feel empowered and to feel like they can be themselves and they can really be authentic to who they are and come to know themselves better and love themselves better. During this experience, I felt like I was having surgery. Like I felt there was a surgery happening on the inside of me. And I took a breath and I just like heard, whether it was from the mushrooms or from myself, and maybe it was both, I heard this like, we need to do this. This is important. You can handle it. You're going to be okay.
Therapists sometimes doesn't have to. It has leaves. One of the leaves thought that it's fall, maybe it was fall.
Content presented in Cheshire Corners is for educational and informational purposes only. Please consult a legal professional if you have any questions or concerns about the content of this disclaimer, this series, or the legal implications surrounding psychedelic substances in your jurisdiction.
Hi everybody, it's a gorgeous day in Colorado. My name is Rita Tsaluk, and I would like to invite you to trip with us through the looking glass. Here at Cheshire Corners Studio, we have our new guest, McKenna Kossow. McKenna is a licensed professional counselor in training.
In training, yeah, candidate.
Welcome.
Thank you.
McKenna has history with psychedelics. She also thinks they're very powerful, and she wants to tell us her story, and we will talk together about the future. So please make sure to subscribe to this channel, and listen to the very end when we're gonna tell you where we're gonna go with all this. McKenna, go ahead. Your floor. Tell us please about yourself and how you become to be a psychedelic believer.
Well, I grew up in California, and my first experience with psychedelics, I would say cannabis is a psychedelic, and to me it really supported me in healing. And actually I really struggled with depression and anxiety, and it helped me feel more comfortable in my own skin. And then about 2017, 2018, I had my first mushroom experience out in the woods. And it was, I really just felt this deep connection to nature and to this deeper power of healing. And so I decided to just embark and really explore more of various psychedelics, LSD, entheogens like MDMA, and really have just come to fall in love with mushrooms specifically. I had an experience with mushrooms where I felt it was really working on my ability to accept myself. And there's this experience that I had where it was like I had agency. Like I could talk with the mushrooms, I could talk with the experience that I was having, and I could not control it, but know that it wasn't being done to me, that I had a lot of autonomy and how the experience was unfolding, and I had a lot of choice. And I think a lot of people experience feeling like they don't have choice in life, and psychedelics really, really unlock people's ability to feel empowered and to feel like they can be themselves and they can really be authentic to who they are and come to know themselves better and love themselves better. And that has ultimately been my experience in my own personal work with psychedelics, but then also what I've found in clients and people I've sat for, that they really just come to understand who they are, they remember who they are, and they feel empowered in it. I was a personal trainer for 15 years, and about 4 years ago, I decided to move into therapy because there were some deeper things that just I wasn't able to touch with like personal training clients on the physical level, that was preventing them from healing and being pain-free or feeling better in themselves. I started my university journey at Regis for 2 semesters in their marriage and family therapy program. And I was really bored, actually, because I knew a lot about what they were teaching me, and there was something missing for me, and it was the relational lens, the transpersonal, the spiritual, the deeper ways of working that I found to be in psychedelics. I left Regis after 2.5 semesters and transferred to Naropa, where I just wrapped up last summer with a transpersonal clinical counseling degree. And yeah, I'm really hoping to be able to support people in finding their way to psychedelics and experiencing this like deep power that they hold in healing and helping us to remember our sacredness and remember that we have choice in our life and choice in how we heal. And mushrooms really do that. You know, there's the science side of things, works with the serotonin receptors and the default mode network, and I think there's a deeper way of engaging with them that I'm really excited for people to experience.
So you're a therapist, a future therapist, or already therapist?
I'm already a therapist, yeah.
Yeah, you're
just
already
not
taking
fully
patients.
licensed yet.
Great. So what kind of therapy you do for them? Are you doing CBT or you doing... What do you do?
I do transpersonal therapy. So I kind of lean a little bit on Gestalt theory. Well, transpersonal is how we're all connected. And so when I'm doing therapy, I'm sitting with like what I'm experiencing while I'm with my client. And what I'm experiencing is what I imagine my client is experiencing, and how do we kind of be in relationship with each other while that's happening. Yeah, I would say I'm very depth-oriented, existential. My favorite clients are the ones that go really deep, that want to be deep, and that can kind of go underneath the surface to really remember who they are. I do a little bit of AC, acceptance commitment therapy, a little bit of somatic therapy, mindfulness-based practices will kind of find their way into my sessions. And then, yeah, I do a little bit of ketamine therapy, and my hope is to eventually be able to offer mushrooms within a therapy context as well. But very much I take a relational approach, a transpersonal approach, and heavily kind of lean on Gestalt therapy and some of the more mindfulness-based type practices. And there's power in CBT. I do a little bit of that, but usually falls into CBT from a transpersonal perspective. Like, how are we changing our thoughts, but also in relationship to those thoughts?
Very cool. I have tons of questions.
Yeah.
So, the first question I have, you think that mushrooms allow you to see that there is more ways in life that you can take, that it's not the one course. How do they do that?
You know, we can look at the science. Mushrooms and other psychedelics really create more neuroplasticity in our brain, and there's more flexibility. But I think in bigger journeys, especially, it really lowers the ego, right? It lowers our sense of what we think should be and what we think is, and allows us to really open up our experience and our perception of what's happening. I think that mushrooms are also, I do believe that they're beings. I think they have a spirit and a consciousness, and their consciousness is essentially rooted in the earth. They do have a cosmic sense to them, but I think that their roots are really showing us that, like, the mycelium goes so many different ways. Like, they grow together, they grow out, they grow in, sometimes they grow up. And it really, I think, allows us to see that, there's multiple paths to where we want to be and what we want to feel. And yeah, I think there's some more, mysticism to how they help us see that there's multiple paths. But I do think it's rooted in the mycelial network and how they spread out, and they're connected all over the world. And we kind of have that similar makeup, I think, that we all have our own roots and our own sort of energetic, maybe, field that we live in, and they can expand and they can feel connected to, like, somebody across the room or somebody across the world. And it just opens our mind up and our system up to receiving more. Yeah, I do think, and that's why I do a bunch of these classes I'm just doing them at Colorado Cultures only because that's who I know, and I don't get out very much, and so it's really cool to have this connection. It was more of like microdosing and therapy, and I spoke a little bit about the science because that's what people want to know about what's happening in the brain and how does it work, but I went into like more so the misconceptions and the expectations that people have with microdosing, and sort of, I don't want to say debunking them, but bringing in a sense of, like, a small dose doesn't mean it's insignificant. Like, it can be actually pretty significant emotionally. And and how a lot of people who do microdose who might have like difficult sort of experiences come up, or they feel more irritable or feel a bunch of emotions coming up that they think that something's wrong because they're expecting it to make them feel better. And I just spoke to like how when we microdose or even take bigger doses, it's really bringing to surface what we need to experience and what we need to feel in order to heal. And it doesn't mean that you're doing anything wrong. It just means you have to listen. And I very much take like a listening approach to working with mushrooms on a microdosing and a macro level. But with microdosing, you really have to have that interoceptive awareness. Like you really have to build your ability to feel and hear what's happening. And so I kind of talk to like, well, what does it look like to listen? What does it look like to drop into a conversation with the microdose that you're taking? What does it look like to feel the sensations that are showing up in your body and let yourself sort of be curious with them and also feel them and feel into like, how is this supporting my healing? What is this in? I think of irritation specifically. I said irritation is information. Sometimes it does mean that you took too big of a microdose. Sometimes it means I think you're also on the fence of maybe not taking enough of a microdose. But oftentimes it's what I found is like it is showing maybe where you've denied your own boundaries, where there's resentment, where you haven't spoken something that needs to be come up, because the irritation is usually coming up when you're interacting with other people. And so I also spoke to like the different approaches. Like there's a transactional approach. So like, what can I get from this? How is this going to fix me? Get rid of this thing, which there's nothing wrong with that. But I think when we are thinking about like, how do we want to build awareness in our lives and be able to live our lives fully and feel happy and supportive, it's not like, what can I take from this thing or what can it give me? But how are we relating to it? And how are we relating to ourselves in the process so that we can feel more like ourselves and feel more, like I said earlier, empowered to like live our life. So I took an approach of like, okay, we can approach it as like, this is what it's doing all of this in the brain, but then also how are we relating to it? And can the relationship to the microdose or to ourselves actually help the microdose work more effectively, have more impact on us? I think it's things I really enjoy teaching and talking about is how do we engage with the experience that we're having, especially when we're taking a substance or taking a plant or a fungi that can actually have really great healing properties. And I do think the healing properties only work as much as we're willing to engage in that healing. I'm going to talk about microdosing and therapy, and what I mean by therapy is psychotherapy specifically. And I think that people come into these conversations from a lot of different places and perspectives, and I try to hold both or all of it, but I'm going to kind of bring in my own perspective of working with microdosing from a therapeutic perspective. I think that having support while you're doing these experiences, whether it's during the experience or before and after, I think is really important. And we can't heal alone. We don't heal alone. And I think that is missing in a lot of people's explorations with psychedelics is having therapy and having a supportive guide present with them. And I do think that it needs to be accessible in a way. I mean, like last year, I had this really big mushroom journey with mushrooms that I grew. And this was the first time experiencing mushrooms that I cultivated. Felt like there was something special in there. But during this experience, I felt like I was having surgery. Like I felt there was a surgery happening on the inside of me. And I was a little concerned about it. But also I knew kind of what was happening. And I could feel myself wanting to sort of panic or like want to change my experience. And I took a breath and I just like heard, whether it was from the mushrooms or from myself, and maybe it was both, I heard this like, we need to do this. This is important. You can handle it. You're going to be okay. And so I took that. I was like, okay, like they're doing surgery on me. Something's being healed right now or being rewired. And I'm okay. I can handle this. I'm strong enough to handle this. I can be with hard things. I was like, I don't have to be. And they even told, like, that's what I heard too, of like, there's this sense of you don't have to be in this hard experience. You can change it at any time. It's actually a theme I get with every single big macro experience I have, is that as I'm collaborating with the medicine, they're like, you don't have to choose this. Like, you can choose to make the experience better. You can choose to have a lighter experience. You could choose to have a harder experience. Ultimately, it's like, what is in your best interest? Like, what's going to be most supportive to you? And in that moment, it was like, okay, I need to have surgery right now. And I'm going to get through it. I'm going to be okay. And yeah, similarly, trust them, but also trust myself that I can get through it and it's going to be okay. We're going to come out on the other side and things are going to be different. Things are going to be better. Things are going to be what they need to be. And I can be with that.
And was it?
Oh yeah. I felt great. Yeah. It was like, I felt like they were rewiring things in the sense of like, I'm supported. I'm held. Like that was a big theme in the experience, was I'm feeling really held by not just the mushrooms, but by the earth, by the ground that was supporting me, by the friends that were holding space for me. And I think most importantly, I'm also held by myself. Like I can hold myself. And I think that's something that a lot of us can remember, is that we're okay, we're alive, we're breathing, and we're capable of holding ourselves. And we're also capable of being held by the people in our lives and by the unseen forces of nature and the seen forces of nature and mushrooms. And everything was great.
Like a good swimmer, let it go.
Yeah.
Let it go. Let the
go.
wave take you.
Let it go. Yeah. Mm-hmm. It's complex. I do think that mushrooms have their own consciousness and their own spirit and being, and I think they can, from an external place, talk to us. I also think they remind us what's already within us. And so in a sense, it could be both. It could be them talking to us, and also could be us talking to ourselves and remembering something deeper within us.
And then if you think that this is all one,
yeah,
we're the talking to whom?
Exactly. We're just talking.
We're
just talking. Yeah. And that's kind of the relational approach. The way that I see it is, and it's kind of what I talked about in how I got started with mushrooms, or my experience of them, or of psychedelics in general. With all of the psychedelics I've done and I've worked with, there's been this level of like, it is a partnership. It's a collaboration. It's not so much of like, what is the mushrooms doing for me or the mushrooms telling me. It's how am I, again, relating and engaging with the mushrooms. I do think there is a level of engaging with the mushrooms where we could think that they're giving us all the power or telling us all the things or healing all of the things, but they're not. They're actually illuminating in us what we already know, what we already feel, what we've just forgotten. And again, it's our engagement with the mushrooms to be able to remember that. I do think that it's a partnership, it's a collaboration. They're guides and teachers, but they're not doing all of the work for us. We have to put some skin in the game, right? And we have to be able to show up in a way that actually supports their work with us.
Thanks for watching. If you liked it, please like and subscribe to Cheshire Corners. Tell me what you think in the comments. And as always, don't get psyched out.